instructor at the GW Center for Integrative Medicine. Cynthia is also an assistant professor at the University of North Texas Health Science Center, as well as the founder and principal of Cynergy Wellness Group, LLC. Thank you for being here, Cynthia.
Thank you so much, Janet, and I'm delighted to be here with you. Delighted to receive this invitation and excited to share information about mindfulness and MBSR. And as I mentioned, for virtual or not the visual learners among us, I do have a PowerPoint presentation. And can everyone see the PowerPoint presentation?
Yep.
Wonderful. Okay. So some of you may be familiar with mindfulness and MBSR. Some of you, this may be a refresher. I'm going to provide a relatively brief introduction to it. We will have a practice as well. And I certainly want to leave a little bit of time to see if you have any questions, and we can discuss maybe how to integrate this, as well as some upcoming events that may be of interest. So MBSR stands for Mindfulness Based Stress Reduction, and the MBSR program is really considered the gold standard of mindfulness training. So my goal is to assist you in learning a little bit more about this 8-week evidence-based MBSR program developed by Dr. Jon Kabat-Zinn. He is an internationally known professor of medicine, a scientist, as well as an experienced practitioner. So we'll just start with what is meditation. Meditation is a mind and body practice that has a long history of use for increasing calmness and physical relaxation, for helping with our psychological balance, assisting coping with illness, as well as enhancing overall health and well-being. And this particular definition is from NIH, the National Center for Complementary and Integrative Health. When I discuss what meditation is, I also find it to be very important to discuss what meditation is not. So meditation is not a religion, and it doesn't require a significant amount of special skills or a unique background. It doesn't demand a significant amount of time on a daily basis. Unfortunately, it doesn't eliminate sadness or the challenges that we experience in our daily lives. And it isn't an attempt to stop thinking or only think about positive things. And there are many different types of meditation. However, most of them have the following things in common: a quiet location with as few distractions as possible, and being in a very comfortable position. And this can be sitting, standing, lying down, walking, for instance. There's also a focus of attention, and this could be a specific word or set of words, an object, or perhaps the sensations of the breath, as well as an open attitude. And what this means is letting go of distractions, this non-judgmental, or at least not having harmful judgments arising. And all forms of meditation really strengthen and direct our attention through the cultivation of 3 key skills, which is concentration, mindfulness, as well as compassion, which is sometimes referred to as loving kindness. So really, what is mindfulness? This definition is from Dr. Jon Kabat-Zinn. Mindfulness means paying attention in a particular way on purpose in the present moment, again, non-judgmentally. Another way of thinking about this is paying attention to our thoughts, our feelings, the sensations within the body, as well as the environment around us without harmful judgment. So mindfulness is a skill that can be developed through practice, just like any other skill. So you could perhaps think of it as a muscle. The muscle of mindfulness grows both stronger and more flexible the more that we use it. And mindfulness is something that we already have. It's just bringing out our inner wisdom, our inner knowledge. And mindfulness is not a technique, although there are many ways to practice mindfulness, and it's not about, again, achieving some special feeling or special state. It's about recognizing that whatever we're feeling at a particular moment, whatever sensation, it's possible to embrace it with a larger awareness and find the means of navigating life in a way that is authentic to us. So mindfulness is really all about being aware. So when we're being actively mindful, again, we are noticing and paying attention to our thoughts and our feelings and our behaviors, as well as the effects on those around us. And we can practice mindfulness anytime, anywhere, with anyone, by showing up and being fully engaged in the here and now. So mindfulness can be practiced both informally, which at any time and place, and formally, which is often during specific meditation. And whereas meditation is usually practiced for a specific amount of time, mindfulness can be applied to any situation throughout the day. So how it works, and I'm going to make this incredibly brief due to the time that we have together today. So recent research in neuroscience shows that we have the power to influence our brains. You may already be very familiar with neuroplasticity. It's the ability of the brain to change by creating and reorganizing neural connections, especially in response to learning or experience, particularly if those experiences are novel and positive. So the prefrontal cortex, often referred to as the mindfulness module of the brain by neuroscientists, is more active during the relaxation response. And this can lead to an improvement in emotion regulation and a wise, authentic response versus a reactive, impulsive, fear-driven response. So when we're engaged in mindful meditation, the parts of the brain that are connected to attention, sensory processing, emotion and stress regulation, as well as empathy and compassion are strengthened. So what is mindfulness-based stress reduction, MBSR? It's a well-defined, systematic, patient-centered educational approach, which uses relatively intensive training in mindfulness meditation as the core of the program to teach individuals how to take perhaps better care of themselves and live healthier, more adaptive lives. So the original intentions for MBSR was as a public health initiative to shift the bell curve of humanity towards greater health, well-being, and wisdom. And research on the program has helped establish MBSR as a viable intervention for a host of physical, emotional, psychological conditions, and it really supports primary and secondary public health goals. So preventing illness and disease, including cultivating inner resources that support resilience and healthy coping, as well as an intervention perhaps for current conditions, especially since stress reduction is really applicable in any disease state, and helping with the effects of chronic long-standing conditions for which recovery may not be possible. So MBSR programs are now offered in over 700 medical centers, hospitals, and clinics around the world. And Jon Kabat-Zinn's work has contributed to a growing movement of mindfulness into mainstream institutions, in addition to medicine and healthcare, including primary schools, higher education, corporations, the prison system, the legal profession, and professional sports, just to name a few. So some of the benefits of mindful meditation: it can help reduce burnout, anxiety, and depression. It can strengthen our attention. It can enhance our cardiovascular health. It can help to reduce inflammation, can help to improve our sleep. It can strengthen abilities, again, of emotional regulation. There's, again, that focus on compassion and a sense of calmness, and a mindful response, if you will, or intentional response versus a reactive, fear-based response, and also can help in self-regulation when it comes to chronic pain. So over 3 decades of research suggests that mindfulness instruction can improve the mental health and quality of life and the life outcomes of diverse clinical as well as non-clinical populations. And research has shown that mindfulness practice can be effective in helping individuals who are dealing with a wide range of health challenges, including chronic pain and stress and depression, relationship challenges, heart disease, grief and loss, again, to name a few. So now I'd like to guide a very brief meditation practice. So I'm going to invite you to be in a very comfortable position. And again, in meditation and in mindfulness, this can be seated or standing or lying down, wherever you'll feel comfortable. But this meditation practice is only going to be about 3 to 5 minutes. So once you're in that comfortable position, resting your hands in your lap, perhaps, or beside the body, perhaps just taking a few deep breaths, tuning in the sensations of breath within the body. Keeping in mind that the mind, the body, and the breath are intimately connected and can influence each other. So once you're in this relaxed, comfortable position, I'm going to invite you to close your eyes or gently lower your gaze if you feel more comfortable. And then just taking a few moments to tune into the body, sensing your intention for being here today. Perhaps taking a few long, deep breaths. Again, tuning into where you feel the sensations of breath within the body. So there's no need to analyze the breath or change the rhythm of the breath. You're just tuning into the sensations of breath. And perhaps it'd be helpful to determine where you feel the breath most succinctly. That could be perhaps in the chest, or the abdomen, or the throat, or the nostrils. As you inhale, it might help to note to yourself silently breathing in. And as you exhale, silently noting breathing out. And you might notice that your mind starts to wander. That is perfectly normal. It's what our minds tend to do. So if you notice that your mind has wandered into thoughts or feelings, feeling a little distracted, just gently bringing your attention, your focus back to the present moment. Perhaps bringing your focus back to the breath, or bringing your attention to touch points of the body. So where your body is touching the chair or the floor. Being kind to yourself in this process. And recognizing that when your mind has wandered, and gently bringing your focus back is actually part of the mindfulness practice. Seeing if there's any tension or feeling of stress or constriction in the body. Seeing if it's possible to just gently release it. And if it's not possible to release these sensations, seeing if it's possible to let it ebb and flow on its own. So in this moment, we're stepping out of autopilot, if you will, where when we're in autopilot, we may be rehashing the past or rehearsing the future. When we're being mindful, we're focused on this present moment. By engaging in this practice, we're strengthening our mindfulness muscle. And as we start to bring this practice to a close, you may want to bring some gentle movement to the body, perhaps wiggling the fingers and toes, rotating the wrist and the ankles, perhaps gently moving the head side to side, or perhaps your body is calling for stillness. So just tuning into the body and noticing what is it that it needs in this moment. And gently opening your eyes if they've been closed when you're ready. Just reorienting yourself to the space that you're in. And now what I'll share with you is just some more specifics about the MBSR program. It's an 8-week, again, evidence-based program. The focus is on secular intensive mindfulness training. And over 30 years of research has really assisted individuals in reducing the suffering that can come with anxiety, depression, illness, and the stressors, really, of our daily lives. And there are a variety of mindfulness practices, including focused attention, which is the practice that we just engaged in, mindful movement, as well as exploring really our patterns of thinking and communication, looking at our behavior and ways in which we can really effectively manage stress in a way that is effective and authentic to us. So some practices that can help cultivate mindful awareness that we focus on during MBSR. Again, mindfulness of the breath, body, and sounds. A body scan where we look toward the body and we tune into sensations from the crown of the head to the tips of the toes. Mindful eating, we explore how to mindfully consume food and drink. Awareness of stress reactivity and a focus on moving from stress reactivity to a mindful response. So again, through the program, looking at particular habits and thought patterns and determining what might be a more effective way of us communicating or managing our stressors. Loving kindness practice is something that helps to bring a greater compassion to ourselves as well as to others. Again, we focus on mindful communication. And then again, mindful movement, which is often either mindful walking or engaging in yoga, gentle yoga practices. Again, tuning into the mind, the body, and the spirit through these practices and strengthening that mindfulness muscle. So some things to expect if you were to participate in the MBSR program. Again, they're experiential mindfulness programs, the breath awareness, the body scan, the gentle yoga. There's a lot of educational material about the mind body and how moving from a stress reactivity to a mindful stress response, looking at the parasympathetic system and the sympathetic system, also looking at neuroplasticity. It's important in the program that there is confidentiality and that the individuals feel that it's really a safe space for them to share information about their experience. There are small group discussions as well as large group discussions where we go over the educational material and the practices and what experience has been and navigating through the program, and then also determining how best to navigate once the program ends and moving back into life, perhaps as it has changed and evolved. There is certainly a commitment to practicing home practice. It's typically about 45 minutes per day. And then there's what we refer to as an all-day session. So in the all-day session, it's typically about 9 a.m. to 4 p.m. And it's most of it is actually in silence. So an MBSR instructor will be guiding a variety of different practices and activities. And it's really an opportunity to tune into an individual, one's own communication patterns, and experience these different practices in a group environment, whether that's virtual or in person. But really, again, focusing on experiencing what it's like to engage in these practices and strengthen that muscle. So some ways that there's some skills that we really focus on is using mindfulness to shift to healthier states of mind. So again, moving from autopilot when we're rehashing the past or rehearsing the future and focusing on that present moment awareness. One of the reasons this is so important is because when we are on autopilot, when we're not focused on the present moment, we could be carrying stress and tension in our bodies without even being aware of it. We could be missing out on critical information that we need to make a really important decision. We could be missing out on the moments of our lives that are truly meaningful and that we want to be present for. So again, it's an ongoing practice. Perfection is not possible, however, transformation is. So another thing that we focus on again is that for moving from that stress reactivity, habitual perhaps way of relating to stress, to a wiser response, a more mindful response. We then move from emotional distress state to perhaps feeling a little bit more of emotional resilience. And this is by really tuning into the mind and the body, recognizing emotions and not pushing them away, allowing them to be, recognizing them, understanding that our thoughts are not factual. Our thoughts are energy. We are more than our thoughts. We are actually the awareness of our thoughts. And then moving from an inner critic, and we all have some element of an inner critic within us, to a more compassionate voice. So I want to share with you some upcoming events, just in case you're interested in learning more about mindfulness as well as MBSR. Nina Paul, who is another mindfulness-based stress reduction teacher, and myself are planning a mindfulness retreat in person in the DC area, somewhere probably at GW. And we're looking at a Saturday in August, and this date will be announced shortly. And then there will be an MBSR 8-week course that is offered online via Zoom. This will be held on Wednesday evenings. It's probably going to start mid-September, and it'll be held from 6:30 to 9 o'clock Eastern Standard Time. And additional information is available through the GW Center for Integrative Medicine website, which is gwcim.com. Here is my contact information. Please feel free to reach out to me if you have any questions or are looking for additional information, additional resources. I would be happy to share with you whatever I have, help you in supporting your practice as you move forward. And now I'm going to stop sharing. And I want to see if you had any questions.
You can put your question in the chat window, or you can just unmute yourself and ask.
This is Lisa Schwartz.
Hi,
I'll
Lisa.
ask Cynthia a question. So is this something that's restricted to just GW folks? In truth, I joined partly for myself, but also for my son, who I think would really benefit. And he's not affiliated. He's graduating from college soon, so.
No, this is open to everyone, really, for adults. Yes. And so it's not specific to the GW community. However, there are special rates available for individuals in the GW community, whether they be staff or faculty or students. But yes, this is open for everyone. And that's one of the beauties, if you will, of having an online MBSR program, because people literally from all over the world can join in. But yes, both for the mindfulness retreat, which will likely be in August, and the MBSR course, which will be starting in September. It's open for everyone who are adults. There is a registration process, and either Nina or I will be reaching out to the individuals who have registered to learn a little bit more about them and talk about what to expect throughout the program, to make sure that it's a right fit for them. And of course, answer any questions that they have. But that's a very long answer to your question. So yes, it's open.
Thank you.
Thank you for that question.
Okay, I'll do a follow-up. So
Okay.
what do you say to folks who are resistant to meditation? I mean, in truth, I find it very difficult to do meditation. So I guess I know it is evidence-based and the rest, but like still for someone who is just not sure it works.
Sure. So a couple of suggestions. One is start slow. So sometimes there are some misconceptions, for instance, about meditation. It has to be for a real specific amount of time, and you're in an uncomfortable position, seated with crossed legs and so forth. And that's really not the case. What's really important, and the most important thing, is taking good care of yourself during that practice and certainly beyond. However, what I typically encourage individuals to do, especially if it's new to them, is starting slowly. That could be like a 5-minute practice or a 10-minute practice, and then building upon that. Another thing that I've heard that's very helpful, and that's been helpful for me at times, is there are different ways to practice meditation and mindfulness. So it's not just seated meditation. You could be involved with meditation and mindfulness when you're in movement. And sometimes that can really help to actually settle the mind when you are engaging your body as well. There's different forms of practices. So some practices people may feel really connected to, and some practices maybe not. And that can change on a daily basis as well. So, and remembering that the mind, or focusing on the mindfulness practice as a muscle. and the fact that the more that we engage in the practice, the stronger and more flexible that mindfulness muscle can be. And the most important thing is being kind to yourself in the process and being patient, knowing that if this, especially change is challenging, even if it's a positive change, being kind to yourself is really an essential part of the mindfulness practice and can help in it really becoming, hopefully, really a lifelong practice.
Thank you.
You're welcome.
All right, if there are no more questions, Cynthia, would you like to close us out?
Sure. Could do one more brief mindful practice. This is typically the way that we start MBSR course, the sessions, as well as we end them with a very brief practice. So again, I just encourage you to close your eyes or gently lower your gaze, whatever feels most comfortable for you. And then perhaps tuning into what we refer to as an anchor or a focal point. And this could either be sensations of breath in the body, or it could be sounds in the room, or it could be touch points where your body is touching the chair or the floor, or it could be even just focusing on the hands or the feet. But just a way to help bring your focus into the present moment. Maybe taking a few moments to share some appreciation for yourself for taking this time for your own self-care and wellness. And again, just gently opening the eyes whenever you're ready, perhaps bringing gentle movement to the body. And again, I appreciate this opportunity to be here with you today, and feel free to reach out to me if you have any questions, and I hope to see you again very soon.
Thank you, everyone. Thank you, Cynthia.
Thank you. Thank you, Cindy.
Thank you. Good
Bye-bye.
night.
Bye, all.